Come in.
Good morning, Mrs. Delarose. My name's Soraya. I'm a nursing student, and I'm going to be the one taking care of you today.
Hi, Soraya.
Why don't you tell me how you're feeling right now?
You know, I'm achy all over. I'm not feeling very good. I've been dizzy and lightheaded. I'm nauseous. I have vomited. And there's this weird purple rash that I've
Really?
seen. Yes.
Where's your purple rash?
You know, I saw it on my arm, but I think it's beginning to spread.
Well, let's take a look. You know, I can see what you're talking about. You're talking about the little purple dots, right?
Yes.
Purple, red.
Yes.
Okay. When did you first see that?
It's been just a couple of days.
All right. And I see these bloody tissues. Did you have a nosebleed or something else?
Yes, my nose has been bleeding pretty frequently. My gums were bleeding when I was brushing my teeth, and that doesn't
Really?
usually happen.
Do you mind if I take a look?
Oh no, go ahead.
All right. Say, ah.
Ah,
Yep, I can see a little bit of blood. Do they usually bleed when you brush your teeth, or is that new?
no, that's new.
Okay. I'm going to come around and look at your IV site. Are you feeling any pain right now?
You know, I do. It feels like I hurt all over.
Kind of an achy feeling?
Yes.
You've got a little bit of blood by your IV too.
You know, I went to the restroom and my stool just looked
Really?
weird. It looked kind of
Dark.
dark and tarry.
And is that new?
Yes.
When's the first time you saw that when you went to the bathroom?
I would have to say last night.
Okay, so all pretty new within the last 24 hours.
Yes.
And I see you left this urine cup here.
Yes.
When did you leave this on the nightstand?
That was just a few minutes ago. I was told to collect a sample next time I went to the restroom.
Okay, and was your urine dark red like this before, or just in the last little while?
It's just been recent.
Okay. I'm going to go ahead and do an assessment on you and take some new vitals, all right?
Okay?
First, I'm going to listen to your heart.
Honey.
I'm going to check your pulses on your wrist.
Okay.
Feel a little bit weak. Slow cap refill. I'm going to check your feet as well.
Okay. Just a little cold right now.
Pedal pulses +1, weak, and thready. Bilaterally. Same as radial pulses. Skin, aside from the purple rash, the petechiae, is a little bit pale and cool to the touch, slightly diaphoretic. Have you felt sweaty like this since you came in, Miss Delarose?
Yes.
Okay, let's take a look at your vitals. Blood pressure's low, heart rate's high, respiratory rate of 22. Do you feel like you're having a hard time breathing?
I actually have been feeling a little short of breath, and it hurts a bit when I try to breathe.
Okay, I'll sit you up a little bit more,
Okay.
or not. And then I'm gonna go check labs for you. They drew some blood recently, and I'm gonna see what came back, and then I'll come back to tell you more, all right?
Okay.
All right. All right, we have a lab report back on our patient, Miss Delarose. Her platelets are low, PT and PTT are prolonged. She has a positive D dimer, which indicates the presence and dissolution of clots. Her hemoglobin is concerningly low. Her BUN and creatinine are high, and there's blood present in her urine, which indicates stress on her kidneys. A little bit of background on this patient. She came in 24 hours ago septic, so her vitals are to be expected, and so to some degree are her labs, except I'm concerned by the fact that this indicates bleeding. So I'm going to call her physician. Oh yes, this is Soraya. I'm the nurse for Miss Delarue. The background on this patient, she came in 12 hours ago through the ED and was admitted to the ICU with a diagnosis of sepsis. Since then, her vitals have remained relatively the same with a low blood pressure, high heart rate, high respiratory rate, currently at 82/53, heart rate of 115, and respiratory rate of 22. Her most recent labs have platelets at 150,000, PT of 19, PTT 46, positive D dimer, hemoglobin 10, BUN 25, and creatinine 1.3. Her urine sample is also dark red. She reported dark tarry stools and has some bleeding from her gums and IV site. She's also reporting shortness of breath, nausea, vomiting, and dizziness. And her skin showed petechiae that appeared within the last 12 hours after her admission, and she's still pale, cool, and diaphoretic. I am afraid that this patient is going into DIC, and I'd like to begin the treatment protocol for DIC, beginning with blood replacement, blood products, FFP, cryo, and platelets.